Hi everyone, just responding to a question that was posted on one of my other videos. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the question is, my stool and oat, which is an organic acid test, both showed as having yeast overgrowth, trying to clear candida biofilms, which are showing as a patch on the tongue. I think it will not show to everyone on the tongue, so I think maybe suggesting it's maybe not obvious to everyone, but the person's noticing it. My oral pathology came as all normal. My doctor hesitated to prescribe EDTA, which is a chelating agent slash biofilm disrupting agent, because it will redistribute metals. I have just sent my hair samples for HMTA, so heavy metal toxicity analysis, I think could be what that stands for. There's different acronyms for hair metal tests and waiting for them. Oh, she said it's a hair sample, so obviously it's a hair sample. Do you test heavy metals for all the patients before prescribing EDTA or DMPS, etc.? So good question. There's been a few questions lately about chelators and whatnot, so always happy to talk about that topic. So in my practice, if I'm going to prescribe DMPS or EDTA or DMSA for that matter, my three top chelators that I recommend, I will absolutely test for heavy metal levels if we're using the chelators to go after heavy metal elevation. So we'll do the testing first, through a provoked urine test, ideally using a provoked intravenous form of heavy metals. Intravenous form of chelators to bind heavy metals, and then if those levels are elevated, then we'll proceed to actually do the treatment with DMSA, EDTA, DMPS, what have you. If I'm using chelators to go after biofilms, then I don't test for heavy metals ahead of time. The main reason is because if we're using, say, EDTA as a nasal spray, for example, the EDTA is very, very poorly absorbed across the gastrointestinal tract. So first of all, we're spraying it up the nose, but of course, there's going to be a little bit of postnasal drip, down the throat, down into the stomach, intestines, etc. But to my understanding, EDTA is very, very poorly absorbed. There are some products out there that make a liposomal EDTA, which to my understanding is supposed to be better absorbed. I'm honestly not sure if they've done pharmacokinetic studies showing whether or not that's the case or not, but the long and short of it is just regular old EDTA, which is what's in the nasal sprays that I use, very poorly absorbed, so I'm really not worried about binding up any heavy metals or healthy minerals for that matter. When I'm using biofilm disruptors for systemic issues or for gut issues, so if we're using biofilm disrupting capsules that have, say, DMPS or DMSA in them, typically along with a mix of bismuth and R plus alpha lipoic acid to make a dithiol. I've talked about this in several other biofilm related videos. Please check those out if you want more information about that. I'm really not worried about binding up systemic metals all that much because it's a relatively low dose that a person's actually taking in with those chelators. Ballpark, it's approximately it's about a 10% of or 10 to 20% of a full therapeutic dose, give or take, of an oral chelation protocol when we're using those binding agent, those heavy biofilm disruptors rather. Sorry, I got a little notification across my screen there, so distracted by that. And so it's a relatively low dose, so I'm really not worried about seeing like a full chelation effect from that type of treatment, so I don't test prior to recommending biofilm disruptors. As a note, I think it is certainly really important to think about, like as clinicians, to think about the safety of the things we're recommending for our patients. And if I thought to myself, oh my gosh, a chelator might redistribute metals in someone, I'd want to be really, really cautious with that. But in my experience and to my understanding, as long as we're using chelators in a sort of responsible manner, the right types of dose, the right types of detox supports and things like that in place as well, I personally feel that the risk of a heavy metal redistribution effect is very likely low. The video that I posted yesterday, which was talking about I think it's entitled something like, "Is chelation therapy safe?" And there was a note about can you ever fully get rid of Borrelia, the Lyme disease causing bacteria. So if you're interested, please take a look at that. But I talk about my opinion on why I think chelation therapy is generally very safe, and that would extend to using chelators in biofilm disrupting forms as well. So I hope that answered your question or gave you some useful information. If anyone has any questions about this topic or anything else, please post in the comment section below, and I will do my best to answer as soon as I can.